So, continuing the September recalls of 2020, a healthy 53-year-old woman with no significant past medical schedule for hemorrhectomy in 6 weeks. Her pre-operative test reveals microcytic hypochromic anemia. So there is iron deficiency anemia, and she has to be posted for. She had to give oral iron supplementation. What test is unreliable for low perfusion? This is about pulse oximetry. Whenever this perfusion is less, that test is not reliable. 25-year-old woman has 2 centimeter mobile lobar mass in the right breast. Age is 25, and this is only 2 centimeter. So there is no axillary lymphadenopathy. Which of the following is most likely diagnosis? So no lymphadenopathy, mass in the central part, center of the breast, non-tender, no lymphadenopathy. This has to be fibroadenoma, mobile, but it is lobulated. Central, you have to think of what fibroadenoma. It has to be rubbery and all that. 38-year-old woman presents undergoes total thyroidectomy, primary thyrotoxicosis, post-operative irritable, demonstrable twitching, limb movements. So this is regarding hypocalcemia. So 50-year-old woman who is on her feet for much of the working day complains of pain and paresthesia affecting third and fourth, the loss of her left foot. Paresthesia affecting third and fourth toes of her left foot. On examination, painful click reproduction of her symptoms failed on applying horizontal pressure across the metatarsal bone. Which of the following is most likely diagnosis? Pain in paresthesia third and fourth. This is neuroma, Morton's neuroma, third and fourth. 30-year-old female bus driver suffers deep burns to her leg after road traffic collision and medical fire. 3 weeks later, she has 7 cm by 5 cm area of ulceration exposing tibia. So grafting has to be done. It is split free flap. Here the split screen graft and all is not possible, so you have to use approximately manufactured covered with the gastrocnemius rotation flap. Middle third tibia. Proximal is gastrocnemius, middle third tibia is fractured, soleus rotation flap. If distal third flap is there, they have to apply free flap because the pedicle cannot be reaching to this much part, so free flap reconstruction is required. It's a little bit difficult. You have to bring the flap from other side. So this is proximal gastrocnemius flap, and middle third soleus can be brought. Which of the following is the nerve most likely to risk of damage from posterior approach of distal femur? Proximal and distal. Which nerve, tibial nerve, is on the posterior? This is the tibial nerve posteriorly and common peroneal laterally. 60-year-old diabetic man is admitted with dry gangrene on the right fifth toe. His digital subtraction angiography, long superficial femoral block and single vessel run off by the posterior tibial artery. Which of the following is most appropriate initial management? So now patient is having dry gangrene, fifth toe, amputation. Even if you do amputation, there is no supply from there is digital subtraction. Angiography shows superior long superficial femoral artery block and single venous runoff. Which of the following is most appropriate initial options? We have to see tibial femorotibial bypass graft has to be done. So here this superficial femoral artery, and from there they have to anastomose it with the tibial artery. You can see the tibial arteries. Now end to side anastomosis, end to end anastomosis, different types of anastomosis. Reverse graft has to be done. Femoroposterior tibial graft. 40-year-old man presents with dysphagia and chest pain. He has normal ECG, normal gastroscopy, 24-hour pH monitoring is also normal. He is having dysphagia. ECG is normal, gastroscopy is normal, pH monitoring normal. He has normal to high pressure waves on esophageal manometry. So manometry is sufficient sometimes. Which of the following is most likely? No, there is no eclasia on esophageal. There has to be eclasia. So let us see. Spasm, pH is normal, it's not eclasia. That's why 10-year-old child presents with persistent bloody discharge, failure to thrive. Which of the following is most likely? Bloody diarrhea is then in the, either it is in the failure to thrive, means this person is having chronic discharge, maybe Mickels or everything, inflammatory bowel disease. This is possible in this. Mickels is not given. Julian polyp is fresh. 78-year-old woman with hyperchromic microcytic anemia is found to have axillary and inguinal lymphadenopathy. Which of the following is most likely? Now, anemia is there, iron deficiency type of anemia, axillary, inguinal lymphadenopathy. It has to be a type of lymphoma, non-Hodgkin lymphoma. What is the difference between Hodgkin and non-Hodgkin? Let us see. Hodgkin lymphoma is localized single group of nodes. Continuous spread stages is strongest predictor of prognosis. Many patients have relatively good prognosis. Characterized by Reed-Stern cell bimodal distribution, adult and older age, is Epstein-Barr virus, constitutional symptoms, low-grade fever, night sweat. This is in Hodgkin's. Now, non-Hodgkin, multiple lymph nodes involve extrarenal involvement, non-contiguous. Majority involves B cells. Can occur in children and adults, may be associated with HIV and autoimmune. Non-Hodgkin HIV, and this is with the Epstein-Barr virus. A 40-year-old man crossing the road hit by the car, he sustained displays closed short oblique fracture of the tibia. Closed short oblique fracture tibia 2 cm above the ankle. Which of the following is most appropriate treatment? Displays. It has displays. Second is closed oblique fracture of the tibia. So fixation with the screws has to be done. There is no need of internal fixation, as it is like this. Tibial fracture, which is displaced short, so post accident appearance is like this. Comminuted fracture, so you have to plating and screwing is to be done. A patient has numbness in ulnar 1.5 fingers, intraocular wasted. Sensation over the dorsum of hand is normal and ring and little finger are clawed. So it is very numbness ulnar and intraocular wasted, means towards the wrist. This is ulnar claw. The ulnar paradox is very close. Ulnar claw is this one, and median claw is partial claw. Median claw, the fingers and the thumb, they get. 45-year-old lady present with hoarseness and firm irregular mass on the right side of the neck, ipsilateral cervical impotence. Which of the following is most likely diagnosis? 45-year-old lady presents with hoarseness and firm irregular mass on the right side of the neck with ipsilateral cervical lymphadenopathy. Hoarseness and firm irregular mass. So if it is about regarding thyroid, it is involving with lymph node, with nerve involvement, means it's not papillary, it's not follicular, it is anaplastic. Hoarseness, okay. Carcinoma of thyroid with hoarseness, it is causing compression. Aggressive local. So lymph nodes still they are going towards papillary. 30-year-old male motorcycle sustained posterior fracture of dislocation of the hip. Fracture dislocation of the hip is posteriorly. The injury is open reduction in internal fixations, and post-operative exam reveals it has loss of sensation and weak of muscle group of his leg below the knee. Which of the following is most likely complication? There is injury at the hip joint and below knee, so posterior compartment has to go for anterior compartment is the sciatic nerve is moving down and tibial is passing posteriorly, and that is the flexors of the ankle joint So let us see. Injury is sciatic nerve. Rest of the thing is, now you see, mark wasting of muscles below the knee. Below the knee, weak flexion of the knee, saturation glacier. These are the knee flexion. Weak extension of the hip, gluteus maximus. All muscles below knee are paralyzed, and weight of the foot causes it. Assume plantar flex, foot drop, stamping gait. So this is foot drop. 18-year-old motorcyclist remains comatose but signs of slow recovery 2 weeks after a major head injury. Which of the following most appropriate initial route of nutrition? So now initial we have to give nasogastric. Then we have to put other options. A 20-year-old woman has 50 centimeter dilated resected Crohn's disease. Which of the following statement is relevant? So there will be deficiency of vitamin, so many things, thiamine, all that can be satisfactorily, you have to go enteral route. 76-year man presents with ulcerated lesion of the scrotum. What is initial lymph node drainage of the scrotum? It is going superficial inguinal. Medial group, again there is superficial lymph nodes. There is medial group of superficial inguinal, not the vertical group. So here they have given this lymphatic drainage. Testis epididymis goes to lumbar nodes, direct para-aortic actually. Prostate, internal iliac, seminal vesicle and ductus deferens, external deep iliac, prepuce and of the penis and scrotum, superficial inguinal, and glans of the penis is deep inguinal. This is what I was telling. Prepuce is superficial inguinal, is skin, and glans is to the deep inguinal. 22-year football player sustains twisting injury to the right knee and was unable to carry on playing due to pain. The next day, general practitioner noted that he has patellar tap, required 4 weeks to regain fullness. In first post-injury matches, suffers twisting injury. On this occasion, GP notes that knee lacked full extension. He is unable to medial meniscal. Whenever there is injury to medial meniscus, so he is unable to extend. So these are the symptoms. Many people experience a pop at the time of injury, and after some days there are swelling and stiffness. Patients often remark that knee feels tight. Sometimes knee is unable to straighten completely and remain locked. Another distinct symptom is that knee feels that it gives a sensation. A man with a family history of bleeding tendency suffers spontaneous hemarthrosis. Which of the following is most likely mechanism? He has got a history. There is a deficiency of some sort of anticoagulants, and if suppose factor VIII deficiency. So this is hemophilia. Inherited blood disorder type 8 classic or type A. What are there? There is no cure. Avoid injury and medicine and promotion. Good nutrition. Good dental hygiene. IV deficient clotting factors. Intracranial possibility. Prolonged nosebleeds can be there. Bruises, worms, swellings, joints, GI hemorrhage, tarry stool, cola colored urine. So these can be possible with a person having hemophilia. 50-year-old man with type 1 diabetes, autonomic neuropathy undergoes inguinal repair as a decay surgery. Which of the following most likely to problem? Definitely there can be wound infection, it can be there. There is orthostatic hypotension can be there. Let us see the options to control this type 1 diabetes. Heart rate variability is there. So reduce pulse rate variability. Autonomic nervous system. Sympathetic fight flight, rest and digest. Heart rate variability. Heart rate variability describes the beat to beat variation in heart rate. Stress, low, high. So there is reduced pulse rate variability. So what is this? Normally autonomic nervous system, it reduces whenever there is stress. Heart rate will This is high, this is low, stress time. The heart rate variability, actually the arteries are stiff, so variability cannot be there. So that is, and that may lead to orthostatic hypotension. The reason has to be like this. So we will just, I will mark it for discussion. "60-year-old man present with shortness of breath, weakness of small muscles of hand and ptosis." Yes. How? 60-year-old man presents with shortness of breath, weakness of small muscles of hand and ptosis. Which of the following is most likely nerve lesion? Weakness of small muscles means nerves is supplying all the. Shortness of breath. What is the relation? 60 years, shortness of breath, weakness of muscles, small muscles of hand and ptosis. Ptosis means it is directly going towards the facial nerve and small hand muscles. If it is central region, let's see the options. T1. Okay, ulnar nerve along with that T1 is involved. So ptosis is drooping of the eyelid. Meiosis, this is a hormonal syndrome, same side nerve. Sympathetic nerves, T1, anhidrosis, failure to sweat, anhidrosis, ptosis, meiosis, and Horner syndrome. So this is shortness of breath is because of any tumor above the apex of the lung that causes compression of T1, that is leading to shortness of breath, lung tumor, and that is causing Horner syndrome. So there is ptosis and T1 root lesion. After resuscitation in emergency department, 30-year-old man with the head injury opens his eyes to painful stimuli and localizes pain. He makes no verbal response. What is so localizing to pain? Opens his eyes to painful stimuli. Then painful stimuli it is 2. Localizes pain is 4. And no verbal response means it's going to no verbals 2 and 4. It has to be near 6 or 7. So what's the option here is motor response is 4 or 5 here, localizing painful stimuli and localize the pain. No verbal response is 1, 6 is and opens eyes in response to pain 2. So localizing is 5, 1, 2. Localizing to the pain is 5. Withdrawal to pain is 4. Flexor is 3. Extensor is 2. And verbal response, no means it is 1. Incomprehensible sounds is 2. And here response, eye opening to pain is 2. 72-year-old woman who was treated for breast cancer 20 years ago presents with the tiredness, constipation, chest pain, reveals localized tenderness of the thoracic vertebra and anterior ribs. Her pulse rate normal, ECG shows shortened QT, hypocalcemia. This has to be, and biochemistry results, calcium is normal. Corrected calcium is 3.8. X-ray shows lytic lesion to the left anterior third rib. Which of the following treatment should be administered? This is 72 years old. You have to go for radiotherapy or chemotherapy. Here is, what is this? Patient is having hypercalcemia. So hypercalcemia, aggressive IV hydration, bisphosphonates, calcitonin. If it is failure, renal dialysis, overload, loop diuretics. So here first of all you have to give sodium chloride. aggressive hydration. 20-year-old woman presents with 3 cm right lobe of thyroid gland with no simple ultrasound examination shows no abnormality. Finite lesion shows papillary carcinoma. Which of the most appropriate treatment? 3 cm hemithyroidectomy has to be done. Tumor more than 1 centimeter. Tumor is less than 1 centimeter. Thyroid lobectomy. So actually, hemithyroidectomy is the treatment. Questions are asked about this. 45-year-old male presents with mass medical steo, perforated urinary ulcer, recurrent epigastric pain, weight loss with the audible succussion supply. Which of the following most disturbance of acid-base balance? Perforated urinary ulcer. Vomiting is always loss of acids, so alkalosis has to be there. Metabolic disturbance, acid-base balance is alkalosis with hypochloremia. Hypochloremic, hypokalemic alkalosis. Sodium, potassium is hypochlorite should be less. pH should increase. No change in pH. That is the thing. Vomiting, loss of chloride, hypochloremic, metabolic alkalosis, and hypokalemic. Paradoxical aciduria has to be there. Gastric outlet obstruction, that is. A 32-year-old woman notices painless swelling in the anterior triangle of the neck, falling respiratory tract infection. Examination reveals soft lump bulging forward from deep to sternomastomas at the junction of upper third and lower third, 3 cm in diameter. Which of the following is most likely diagnosis? Respiratory infection. After that, there is lump bulging from the sternomastoid. Now, options are lymphoepithelial. It's a branchial cyst. It's always anterior. So it is bigger size. Age is more. Branchial cyst is there. It's arising from the second cleft, branchial size from the second cleft. A young footballer receives a kick off to the chest. He has very severe pain localized in the mid-axial line. Posterior anterior chest X-ray has taken 3 hours later. Excludes pneumothorax, confirmed fracture of fourth rib. Which of the following? He is just getting the pain. You have to give painkiller and discharge. Oral analgesia. 25-year man is involved in rugby tackle, briefly amateur match and briefly loses consciousness. He watches the rest of the game from the sidelines. 6 hours later game, he found unresponsive in the bed. Glasgow coma scale is 10. Pupils bilateral 4 mm and right is sluggishly reactive while left reacts normally. This is most likely due to extradural hemorrhage. Lucid interval, blunt trauma is there. Initial confusion, lucid interval, change in mental stressors, patient become confused. 45-year-old man is brought to that ambulance to the emergency department following motorboat coagulation. On arrival, he is conscious, complaining of pain in both lower limbs and upper abdomen. Heart rate is normal. Blood pressure is low. Which of the following steps should be taken in the first? So this person is conscious, complaining of pain in lower limbs. There is no tachycardia. Heart rate is not increased. BP is low. So you give fluid challenge. Hemorrhage protocol. Tassus 2 positive hemorrhage protocol. 6-year-old girl has boiling water split on the forearm 3 hours ago. It occupies dorsum of the hand. Which of the following most appropriate treatment? You flush the water. If there is not leave the dressing here to apply occlusive dressing. 50-year-old woman is found to have small form diffuse goiter with hypothyroidism. Which of the following is discriminative? Investigation. 50-year small form diffuse goiter is T3, T4, TSH, then has thyroid antibodies. 44-year-old woman admitted sustaining mid-shaft femur after tripping from a single step at the home. This 44, she said she had lost her appetite, lost 7 kg last month. Next morning, she is due to undergo fixation of the femur. Her respiratory rate is utna, heart rate is normal, oxygen saturation room is less. Which of the following is the prominent test? CT pulmonary angiogram. Pulmonary embolism. You have to rule out pulmonary embolism in this patient. 60-year-old complains of aching, heaviness, numbness, and tingling in his thighs. The symptoms are precipitated by standing or by walking 10 minutes. They are relieved by sitting down. He has noticed that down still is more troublesome than going up still. Which of the following is most likely diagnosis? 60-year-old is complaining of aching, heaviness, numbness, and tingling in his thighs and legs. The symptoms are precipitated by standing or by walking for 10 minutes. Heaviness, numbness, and tingling of thighs. They are relieved by sitting down. They notice the walking down still is troublesome, going uphill. Claudication or what is they are telling about? This is spinal stenosis. Walking down still is difficult than going uphill whenever there is downhill. Classic presentation is radiating pain associated with walking that is relieved by rest. When the patient bends forward, the pain diminishes. The primary symptoms are discomfort, sensorial weakness in the legs, reflecting improvement of the spinal nerve roots when lumbar canal. The low back pain is not necessarily associated with the claudication symptoms. Rarely patients with lumbar stenosis present with cauda equina syndrome bilateral. So this is about that. 47-year-old man presents with acute onset of knee pain of 2 days duration. He has no history of trauma, apyrexia of his white blood count, and further test is most likely to lead definitive diagnosis. So what is there? 47-year man is there with acute onset of knee pain. There is pain in the knee joint, knee of 2 days duration. He has no history of trauma. Everything is normal, just knee pain is there. Further test, what test is most likely to lead to definitive diagnosis? There is knee pain, so what is the test? Arthroscopy. This is something very different. Fluid aspiration for analysis. There is no fever. That's why this is confusing. Arthroscopy for the knee pain. 27-year-old man presents with recurrent perianal Crohn's sepsis and transsphincter anal fistulae. Which of the following is most appropriate management? Now there is fistula and it's not possible even if you exercise it because recur. So what is the management? Loose training setons. Setons has to be kept. That has to be instead of doing fistulectomy. 70-year-old woman presents with sudden onset of lower abdominal pain. Previous history of constipation. There is tenderness guarding the lower abdomen marked on the left side. Now 70-year-old. Diverticular disease very common. Now again 8 days after the total hip replacement. This is 8 days. 72-year-old man complains of left pleuritic pain. On deep breathing and dyspneic on exertion, he received course of flucloxacillin, subcutaneous enoxaparin, blood gases, analyze partial pressure of oxygen 7.6, PCO2 is less, PO2 is also less. Which of the following is most likely? Now osteoarthritis hip replacement was done and he has completed 8 days. So deep vein thrombosis possibility is there, leading to pulmonary thromboembolism. Fat embolism has to be very fast. It has to be, so this is deep vein thrombosis, pulmonary embolism due to DVT. Now next question is 36-year-old tall Marfan syndrome prime gravida presents in an emergency department with a history of sudden chest pain. Her father died 42 years, heart attack. On examination there is abnormal physical sign then tachycardia and her anxiety. Which of the following is diagnosis? This tall slim means patient is having primary emergency sudden chest pain. So aneurysm possibility is there. So dissection is there. This Marfan syndrome, mitral blobs, aortic dissection, regurgitation, fingers and all this. So aortic dissection possibility is there. 25-year-old right-handed carpenter is to undergo open reduction and plating of fracture of right distal under general anesthesia. Tourniquet. Which of the following pressure is correct? Procedure is correct for managing tourniquet. So Ishmark bandage is done. First of all, you have to extinguish, means remove all the blood by elevating, then compress it, then level and then deflate and inflate after every. Inflate the cuff above systolic pressure after exsanguinating the arm. This is the way. Just this is by exsanguating, by lifting the arm or leg. You have to just exsanguate the arm. Then you have to inflate it. Then again in between inflate and deflate. Whenever surgery is done, Pierce block is given. 35-year-old driver is taken to the resuscitation room, having been thrown through the windscreen when he crashed into the bollard. On secondary survey, he noted that bilateral circumoral bruising on his eyes cannot be opened due to massive swelling. His front teeth do not meet as previously when he tries to bite. Which of the following most likely diagnosis? Now, this facial injury, Leaford type facial injury. If you suppose Leaford, it has to be Leaford 3. Fracture of the maxilla is there. Fracture maxilla, fracture nasal bone, nasosmoid. So this is 20-year-old. Leaford 1, maxillary fracture and malocclusion. Post-operative result after open. This is front teeth. Second, noted that bilateral circumoral bruising. Eyes cannot be opened. It cannot be Leaford 1. 70-year-old man is receiving a blood transfusion following massive hematemesis. Within 1 hour of transfusion, he starts complaining of feeling unwell. Which of the following delayed complication of hemolytic transfusion? ABO incompatibility, jaundice, hemolytic. Delayed hemolytic transfusion, this is because of life-threatening acute hemolytic is abrupt. A 24-year man with a history of Crohn's disease, generalized bone pain, tenderness in the right thigh. He is also increasing muscle weakness, increasing difficulty in walking and change of gait. Serum calcium and phosphate are low, but alkaline phosphate and parathyroid are elevated. Calcium phosphate low, parathyroid, primary hyperparathyroidism. So what is the cause? Here is osteomalacia. 36-year-old man with a recent history of surgery for inflammatory bowel disease, complicated by infection presence with watery diarrhea but no abdominal mass. Which of the following is most likely diagnosis? Recent history of surgery for inflammatory bowel disease, complicated by infection. 36-year-old man with recent history of surgery for inflammatory bowel disease with watery diarrhea but no abdominal mass. This is uncertified pseudomembranous Clostridium difficile. Pseudomembranous colitis has to be there because of Clostridium difficile infection because of antibiotic. 68-year-old man presents to the emergency department with severe chest pain, concurrently left lung that is painful and cold. He is known to be hypertensive. Chest X-ray reveal widening of mediastinum. What is most likely progress? Pathological process. Severe chest pain, widening mediastinum. It has to do with aorta, dissection of aorta. Now, 37-year man with dysphagia to solid and long-standing history of reflux, treated which of the following 37 dysphagia to solid liquids are passing. So you have to think of stricture. Liquids are passing. Achalasia is reversed. Dysphagia to liquids, solids are passing because of weight. 75-year-old trips on the walking upstairs, sustains proximal pretibial triangular flap laceration. Pretibial. The wound cannot be approximated. Appropriate method is pedicle graft or delayed skin grafting. This is upstairs, sustains proximal is 75. Age is very old. That's why you have to apply. Elderly bronchitic man falls in the street. Elderly bronchitic. He was having severe pain localized in the mid-exit line, posterior anterior chest. Excludes pneumothorax. Hemothorax confirmed fracture of the fourth rib. This patient needs admission and observation. 20-year man attends emergency department with history of fall from first store window into outstage hand. Department with a history of fall from first store window onto outstage hand. He complains of tingling and pins and needles of the thumb, index, and middle finger. Which of the following is most likely diagnosis? So now thumb, index, and middle finger means median nerve is trapped or injured. Let us see. This is dislocation of lunate, in which lunate there is medial nerve involvement. Whenever I see medial nerve, there is lunate, dislocation of the lunate. Motorcycle is involved in collision. He has fractured of shaft of his femur. He has very severe localized pain in mid-axillary line. Mid-axillary line, posterior anterior chest taken shows pneumothorax. Is scheduled for internal fixation of his femur on next operating list. Which of the following is most appropriate therapy? So now he has got severe pain in mid-axillary line. Now fracture shaft of his femur, mid-axillary line, posterior anterior of half an hour, show pneumothorax. He has to be given tube, chest tube has to be there. 25-year-old woman collapses at home on admission. She is shocked but gives a history of generalized abdominal pain, and on lying down, pain is on the right shoulder. Tip: on examination, the tachycardia of 140, blood pressure is utna. She is shocked but gives history of generalized abdominal pain, abdominal guarding. Which of the following like this? Collapses at home on admission. She is shocked. Abdominal pain, there is free fluid, there is peritonitis or something free fluid which is causing tip pain, shoulder, peripheries are cold, warm, there is hypovolemic bleeding inside. Rupture ectopic pregnancy is the common. 68-year-old man has undergone emergency surgery to repair a leaking aortic aneurysm. He underwent transfusion in 6 units. Blood test performed 2 hours post-operative show with following results. So after 2 hours, hemoglobin is still a little bit low, WBC count is very high, platelet is low, activated partial thromboplastin is normal, inter-INS ratio is 2.2, fibrinogen. What will these results be consistent with? 6 is disseminated. Platelet is low, that is the thing for DIC. Rest of the thing is nothing is important. Fibrinogen, this is less. FDP, fibrinogen products. 50-year-old sustains a displaced distal fracture, radial of the distal radius fracture, which is manipulated under anesthesia. 3 months she returns to fracture clinic and painful immediate pronation. Which of the following? There is a malunion. Patient presented with post-phlebitic syndrome. Which of the following most accurate? Post-phlebitic syndrome. Now we have to give heparin or something, low molecular heparin, graded compressive stocking, or post-thrombotic syndrome signs and symptoms. A 70-year-old woman gives a history of increasing neck swelling in the region of thyroid over a period of 3 months, and following is most likely. 70-year increasing neck swelling, thyroid, there has to be some sort of malignancy, and increasing very fast means aggressive. 5-year boy has intense cardiac that was earache was relieved when the discharge commences. Michael reveals inflammation of H. influenza. He is mild conductive hearing loss. Which of the following is most likely diagnosis? So acute otitis. So it is acute otitis. Acute otitis media. Twenty-year-old man traps his finger in the door and presents with crushed index finger, sustaining bursting laceration of the pulp. Which of the following is most appropriate technique to administer local anesthesia? Digital ring block. 41-year man has a nasal FR defect showing excision of basal cell carcinoma. So here you have to get the nasal flap, local flap has to be done. 65-year-old woman presents with hard irregular lymph node in both femoral triangles. History confirms she has noted spot of fresh blood under her clothes. So this is vulval malignancy. So this was about